All right. Thank you for the introduction. I'm Joonhyuk Park, the co-first author of your work, DISCLOSE. So I'm pretty sure everyone here is familiar with what an Alzheimer's disease is, and that AD exists on a continuum, which develops gradually over time, starting with biological changes and then to symptoms. And within this continuum, there is a stage called mild cognitive impairment, or MCI. And it is known that about 30 to 50% of those with MCI progress to Alzheimer's dementia within a decade. So previous works have done a simple binary classification to figure out whether a patient with MCI would progress to Alzheimer's dementia or not. And there have been studies on analyzing brain regions independently, meaning that they've analyzed a single brain region and how that region would affect in the Alzheimer's continuum. Also, there is some work regarding brain atrophy observation on how atrophy would affect in the AD continuum. But what we really want to know nowadays is what happened in the brain over time, and how will different brain regions interact with each other, and how do other biological factors contribute to the brain atrophy. So to answer these questions, our work focuses on modeling neurodegeneration dynamics. So far we've talked about AD continuum. And in fact, this AD continuum can be considered as a dynamical system of neurodegeneration. And the goal of our work is now performing neurodegeneration dynamics prediction of individuals using baseline information and with interpretability. Here, what I mean by using baseline information is that we only use a single state information instead of using the whole trajectory or the longitudinal data of a subject when we perform the prediction, because it may not be available in practical applications. So these three goals are important because the dynamics may vary by subjects. And as I said, in practical clinical applications, the longitudinal data may not be available if that patient is in their initial visit to the hospital. And also, we want to know which regions will correlate, are correlated. Right, so let's start with defining what a neurodegeneration dynamics is. So we start with an assumption that an ODE governs the brain atrophy progression in the AD continuum. And we define this ODE as the neurodegeneration dynamics. And considering the static covariates like the biological information or genetic information that could affect the AD continuum, we can redefine the ODE as the equation below. So with this assumption in mind, we propose a novel framework called DISCLOSE, Dynamics Individualized by Static Covariates Without Longitudinal Screening. The DISCLOSE framework is composed of two stages. First is the population level dynamics prediction using the atrophy information, which is done by a deterministic ODE discovery method called CINDI. Next, we perform a personalized dynamics model that uses subject-specific covariates. And in the DISCLOSE framework, we use a deep neural network to perform the individualized dynamics prediction, given the two static covariates as input, which are epsilon and beta, which I'll explain later in the slides. And we also use a novel DISCLOSE loss function. So DISCLOSE loss function is composed of three components. First is the reconstruction loss, which directly aligns the predicted and real atrophy. Then we also use dynamics difference, which guide the individualized dynamics to not deviate from the global population dynamics. And finally, the lasso regularization to ensure sparsity to the predicted dynamics. So for our experiments, we used ADNI dataset, which is a well-known public dataset for Alzheimer's disease, and we used 2,292 MRI scans from 371 subjects. And each subjects have APOE4, amyloid, and quantified atrophy values, and I'll explain this one by one. So APOE4 alleles is basically an integer value of 0, 1, or 2, which each falling into the categories of APOE4 non-carrier, heterozygote, and homozygote. And it is known in the Alzheimer's Society that the more APOE4 genetic variants you have, the higher risk of progressing to the Alzheimer's dementia. Next is the global amyloid SUVR. So actually, amyloid beta protein accumulation is a well-known pathological hallmark of AD. And accumulation of such protein yields plaques between neurons, and these plaques may lead to malfunction or loss of neurons. So to quantify such accumulation amount, we used a standard uptake value ratio, or SUVR technique, which can quantify the amount of accumulation of amyloid beta protein from observed in PET image into a value of 0 to 2. So we use the APOE4 and amyloid as the standard static covariates of a subject, and we use the quantified atrophy value as the feature of a subject. So the quantified atrophy is computed by using a normative percentile against cognitively normal population. And basically what this means is that if you have a small NP value, then that means the volume of the brain region of a specific subject is smaller than those compared to the cognitively normal population with same age and sex. And that would also mean that greater atrophy. So we conducted a trajectory prediction task along different timelines and found that DISCLOSE framework outperforms baseline methods in all timelines. And by utilizing the full loss term, which improves sparsity and MAE performance with the trade-off of RMSE values. But there's much more interesting facts than just looking at these numbers. So I'll move on to the interpretation section. So the table here shows the top 5 connectins of the average predicted dynamics. And first, you can see that the stronger regional correlations are found in higher conversion risk groups. So as I've explained earlier, if you see the row, the more APOE4 genetic variants you have, the higher risk of progressing to Alzheimer's dementia. And the same thing happens along the accumulation of amyloid beta protein, where you can see it here. And if you see the coupling strength, which I've marked in red boxes, the coupling strengths steadily increase along the accumulation of amyloid beta protein and also the number of APOE4 genetic variants. Also, we found some atypical AD patterns captured in amyloid beta negative MCI subjects. So unlike typical AD, where the atrophy progress from the temporal lobe, which is in the middle here, atypical AD, such as posterior cortical atrophy, progress from the posterior and occipital lobe, as you can see in the back of the brain. And if you take a look at the lower row of the table, you can see that many of the ROIs are observed from the occipital and posterior lobes, capturing the atypical AD patterns. So to wrap things up, we proposed a disclosed framework which performed individualized neurodegeneration dynamics using baseline information only with plausible and interesting interpretation. And we showed superior performance with results supported by previous AD-related works. And due to the time limit, I've skipped many of the details, so please feel free to come to the poster session for further discussion. Thank you.